muscles of facial expression have also been removed. Here's the orbicularis oris, here's the buccinator. The two are closely associated. We'll look at the buccinator first. Here it's partly hidden by the masseter muscle, which we'll remove. The buccinator is a thin pouch of muscle that closely follows the contours of the mucous membrane of the vestibule. It has a long line of origin. The buccinator arises from the maxilla and from the mandible along these lines. Above, the line of attachment curls round behind the tuber of the maxilla. Below, it curls round onto the buttress of the mandible. Between these 2 points, the most posterior fibers of the buccinator arise from the pterygomandibular band. The buccinator muscle passes forward and divides at the corner of the mouth. Its fibers continue forwards to become the deepest part of the orbicularis oris. The orbicularis oris muscle complex surrounds the opening of the mouth. It consists partly of intrinsic fibers, but it's formed mainly by the fibers of other muscles, on the deep aspect by the continuing fibers of the buccinator, and on a more superficial level by these muscles of facial expression. We'll take a good look at them in the last section of this tape. The action of the orbicularis muscle is to press the lips together, closing the mouth. The action of the buccinator is to prevent the cheek from distending when we raise our intraoral pressure. When we let the buccinators relax, this happens. Now that we've looked at the muscles of the cheek and lips, we'll move on to look at the teeth. These are the lower teeth of a young adult. In the full dentition, there are 16 teeth above and 16 below, 32 in all. In each quadrant, there are 2 incisors, 1 canine, 2 premolars, and 3 molars. This individual's 3rd molars have been removed. The incisor teeth are flat and chisel-shaped. The canine teeth have a crown that's cone-shaped and a massive root which forms a prominence in the gum. The premolar teeth are broad and short from front to back. They have 2 projecting cusps. The molars are longer from front to back than the premolars and have from 3 to 5 cusps. Each tooth consists of a crown, which projects above the gingiva, and a root or roots which are embedded in bone. The tip of the root is called the apex. The crown and the root meet at this slight narrowing, the neck. The crown is covered on the outside with enamel, which is extremely hard. The inner part of the crown and the root are made of dentin. The tooth is fixed to the surrounding bone by a layer of specialized periosteum, the periodontal membrane or ligament. The space within the tooth is the pulp cavity. The pulp of the tooth contains blood vessels and nerves, which enter through the apical canal. The incisors and canines have 1 root. The premolars have a single root that's forked at the end. The molar teeth have multiple roots. The upper ones have 3, the lower ones usually have 2. Now that we've looked at the teeth, we'll move on to look at the glands that produce saliva, the salivary glands. There are 3 salivary glands: the parotid gland on the side of the face, the submandibular gland beneath the body of the mandible, and the sublingual gland in the floor of the mouth. We'll look at the parotid gland first. Part of the parotid gland lies superficially in the posterior part of the cheek. Part of it lies deep in the space between the ramus of the mandible and the sternocleidomastoid muscle. We'll look at the deep part first. To look at the deep part of the parotid gland, we'll start with a dissection in which the whole of the gland has been removed. This is a good opportunity to see, all in one place, a number of structures that we've learned about separately. Let's take a good look round. Here's the posterior border of the ramus of the mandible. Here's the zygomatic arch, Here's the external auditory meatus. Here's the mastoid process. Here's the sternocleidomastoid muscle. Here's the masseter muscle. Here's the space that's occupied by the deep part of the parotid gland. Here's the posterior belly of the digastric muscle, lying deep to the sternocleidomastoid. Here's the styloid process and the stylohyoid muscle. Here, emerging behind the styloid process, is the trunk of an important nerve, the facial nerve. The facial nerve, which provides the motor innervation to all the muscles of facial expression, has an important relationship to the parotid gland. It runs right through it, dividing into several branches as it does so. Now that we've seen the space that's occupied by the deep part of the parotid gland, we'll add the deep part of the gland to the picture. Here's the cut surface of the parotid gland. Again, here are the sternocleidomastoid muscle, the masseter, and the ramus of the mandible. Before we add the superficial part of the parotid gland, we'll add the facial nerve to the picture. Here's the trunk of the facial nerve, entering the parotid gland from behind. The branches of the facial nerve fan out, upwards, forwards, and downwards. We'll take a more complete look at the facial nerve in the next tape in the series. Here, we're concerned only with its relationship to the parotid gland. Now we'll add the superficial part of the gland to the picture. Here it is. The superficial part of the parotid gland covers the posterior part of the masseter muscle. Its extent varies. It usually extends up as far as the zygomatic arch and down to the angle of the mandible. It can also overlap the anterior border of the sternocleidomastoid muscle. The saliva that's secreted by the parotid gland passes into the parotid duct, which emerges from the anterior border of the gland and passes forward around the anterior border of the masseter. The parotid duct enters the oral cavity, passing through the buccinator muscle and through the underlying mucous membrane at about the level of the second upper molar tooth. Next, we'll look at the submandibular gland. The submandibular gland lies under the posterior part of the body of the mandible. We'll start by looking at a dissection in which the gland has been removed. Again, we'll take the opportunity to review the bony and muscular anatomy. Here's the body of the mandible. Here's the body of the hyoid bone. Here's the anterior belly of the digastric. Here's the digastric tendon passing through the stylohyoid muscle. Here's the mylohyoid muscle. Here's the styloglossus. Here, deep to the digastric, is the hyoglossus muscle. Now we'll add the submandibular gland to the picture. Here it is. The submandibular gland curls around behind the free border of the mylohyoid muscle, so that it has a superficial part, which we can see here, and a deep part. To see the deep part, we'll remove the superficial part. Here's the cut edge of the deep part of the submandibular gland, between the mylohyoid and styloglossus muscles. It extends forward to about here. The saliva that's produced by the submandibular gland passes into the submandibular duct, which runs forwards in the floor of the mouth. To see the duct, and also to see the third salivary gland, the sublingual gland, we'll look at a specimen consisting of the mandible, the tongue, and the floor of the mouth. We'll remove the alveolar process, and we'll remove the mucous membrane. Here, just beneath the mucous membrane, is the sublingual gland, which we'll see in a moment. For now, we'll remove it too, to see the submandibular duct. The submandibular duct runs forward in the floor of the mouth, alongside the base of the tongue. It ends here, just beside the frenum. To see where it starts, we'll go round to the back. Here's the submandibular duct. Here's the submandibular gland. The duct passes forward in the interval between the mylohyoid muscle and the muscles of the side of the tongue, the hyo and styloglossus muscles. Now we'll go round to the front again and put the sublingual gland back in the picture. The sublingual gland is thin, flat, and somewhat diffuse. It lies alongside the base of the tongue, just lateral to the genioglossus muscle. The saliva formed by the sublingual gland enters the oral cavity by way of several very small openings in the mucous membrane of the floor of the mouth. The openings are too small to see here. Now that we've looked at the salivary glands, we'll move on to complete our picture of the structures around the oral cavity by looking at the pharynx. To understand the lower part of the pharynx, we need to look at two important structures that we haven't seen yet, the thyroid cartilage and the cricoid cartilage. The thyroid cartilage is here, below the hyoid bone. The cricoid cartilage is here, just below the thyroid cartilage. Here are the thyroid cartilage and the cricoid cartilage together. The cricoid cartilage is partly enclosed by the larger thyroid cartilage. We'll look at the thyroid cartilage first. The thyroid cartilage consists of two slightly curved plates, the laminae. The laminae are joined together in front. They're widely separated behind. The laminae meet at an angle of 120 degrees in the female, 90 degrees in the male. This is a female specimen. In the male, the thyroid cartilage projects forwards, giving rise to the laryngeal prominence, also known as the Adam's apple. Above, the two laminae meet in a V-shaped notch, the superior thyroid notch, that's easy to feel, just above the laryngeal prominence. On the sides of the lamina are two projections, the superior and inferior tubercles. They're joined by this slight ridge, the oblique line, which is a major muscle attachment, as we'll see. The posterior border of each lamina is prolonged upward and downward to form two projections, the superior horn and the inferior horn. The superior horn points upwards and backwards, the inferior horn points downwards. The thyroid cartilage hangs directly below the hyoid bone. The upper border of the thyroid cartilage has the same curvature as the arch of the hyoid bone. The thyroid cartilage is suspended from the hyoid bone by this membrane, the thyrohyoid membrane. On each side, the posterior part of the membrane is thickened, forming the lateral thyrohyoid ligament. The inferior horn of the thyroid cartilage articulates with the cricoid cartilage at the cricothyroid joint. Unlike the thyroid cartilage, which is open at the back, the cricoid cartilage forms a complete ring. Let's look at the cricoid cartilage by itself. It's much taller behind than in front. The narrow part in front is the arch. The tall part behind is the lamina. The inferior horn of the thyroid cartilage articulates here. Below, the cricoid cartilage is continuous with the upper end of the trachea. The cricoid and thyroid cartilages form the framework for the larynx. We'll see them in that context in the next section of this tape. We're concerned with them in this section because they also give attachment to some important muscles of the lower part of the pharynx. Now that we've seen them, let's look at the pharynx. To get a view of the pharynx from the side, we'll start with a dissection in which all the neck muscles are present. The only parts of the pharynx we can see are here and here. To get a better view, we'll remove the sternocleidomastoid muscle. We'll also remove all the underlying nerves and blood vessels. Here, just in front of the vertebral column, are the longus capitis and longus cervicis muscles. Here, below them, are the scalene muscles. Here's the lower half of the pharynx. The pharynx lies just in front of the longest muscles. To see the whole of the pharynx from behind, we'll remove the vertebral column and all the neck muscles. Here's the pharynx. The pharynx extends from the base of the occiput to the level of the top of the clavicle. The upper part of the pharynx is partly hidden by the digastric muscle, which we'll remove. The upper part of the pharynx is hidden also by the styloid process and the three muscles that descend from it, stylohyoid, which we'll remove, and two other slender muscles which we'll meet shortly, styloglossus and stylopharyngeus. For now, we'll remove them too, along with the styloid process. Now we can finally get a clear view of the whole of the pharynx. Here above the pharynx is the base of the occiput. These are the occipital condyles. Here's the medial pterygoid muscle, sloping downwards from the medial pterygoid plate, which is here. The wall of the pharynx is formed by an almost continuous layer of muscle, lined by mucous membrane. The muscular layer consists of three sheets of muscle, the constrictor muscles, superior, middle, and inferior. These overlap behind, the one above inside the one below. Here's the inferior constrictor. Here's the middle constrictor. Here's the superior constrictor. The superior constrictor is very thin. Its fibers arise from the lower part of the medial pterygoid plate, the hamulus, and the pterygomandibular band, and also from the side of the tongue. The superior constrictor has a free upper border. Above this, the wall of the pharynx is formed by this layer of fascia, the pharyngobasilar fascia. The highest fibers of the superior constrictor insert on the base of the occipital bone. The remaining fibers meet in the midline with the fibers from the opposite side, extending down to here, inside the middle constrictor. Here's the middle constrictor. It's a thicker muscle. The middle constrictor arises from the lesser horn and the greater horn of the hyoid bone. Here's the tip of the greater horn of the hyoid bone. Here's the edge of the lateral thyrohyoid ligament. The fibers of the middle constrictor fan out, meeting with those of the opposite side, from here down to here, inside the inferior constrictor. Here's the upper border of the inferior constrictor. It's thicker again than the middle constrictor. The inferior constrictor arises from just behind the oblique line on the thyroid cartilage, and also from the side of the cricoid cartilage. Its fibers fan out, meeting with the fibers from the other side, all the way from here down to here. The lower end of the inferior constrictor muscle is continuous with the muscular coat of the esophagus. The lowest part of the inferior constrictor, which is functionally separate from the rest of the muscle, is referred to as the cricopharyngeus muscle. It forms a sphincter round the upper end of the esophagus. To complete our picture of the upper part of the pharynx, we'll put the styloid process back, along with two of its three muscles. The longer one is styloglossus, the shorter one is stylopharyngeus. Stylopharyngeus runs down outside the superior constrictor and passes into the wall of the pharynx between the superior and middle constrictors. Styloglossus passes downwards and forwards alongside the superior constrictor and enters the posterior part of the tongue, joining with hyoglossus. To complete our picture of the pharynx, we'll look at a specimen that's been divided in the midline. Looking at the pharynx from the inside will also let us see the muscles of the palate that we left out of the picture in the previous section. Here's the pharynx. Throughout its length, the back wall of the pharynx lies just in front of the vertebral bodies and the longest muscles. with a layer of loose fascia in between that permits movement. The pharynx opens forwards into the nasal cavity, the oral cavity, and the larynx. Up here it opens laterally into the auditory tube, as we've seen. Down here it opens downward into the esophagus. The pharynx is often described in three parts: the nasopharynx, which we've looked at already, the oropharynx, and the hypopharynx, also sometimes called the laryngopharynx. The muscles of the palate we haven't seen yet lie directly beneath the mucosa, which we'll remove. Here's palatoglossus. It arises here from the palatal aponeurosis and passes downwards and forwards to insert on the side of the tongue. Palatoglossus pulls the soft palate downward and forward. Here's palatopharyngeus. It arises partly from the edge of the hard palate, partly from the palatal aponeurosis. Palatopharyngeus passes downwards and backwards to blend with an almost continuous layer of longitudinal muscle that lines the lower part of the pharynx. The lowest fibers of palatopharyngeus insert here on the posterior border of the thyroid cartilage. The palatopharyngeus muscle lies inside the constrictor muscles, hiding them almost completely in this medial view. From here we see only the upper part of the superior constrictor. We'll take a closer look at it. Here's the upper free border of the superior constrictor muscle. Coming in towards us from above are structures that we met earlier in this tape: the levator palati muscle, the tensor palati muscle, and the cartilage of the auditory tube. Now let's review what we've seen of the oral cavity, the muscles of the cheek and lips, the teeth, the salivary glands, and the pharynx. Here are the gingivae, the hard palate, the soft palate, and the uvula. Here are the palatoglossal arch and the palatopharyngeal arch. Here's the tonsil. Here's the pterygomandibular band, the buccinator muscle, and the orbicularis oris muscle. Here are the teeth, the incisors, the canine, the premolars, and the molars. Here's the crown of the tooth, the root, and the apex. Here's the neck, here's the pulp cavity, here's the apical canal, and the periodontal membrane. Here's the parotid gland, and the parotid duct. Here's the submandibular gland, and its duct. Here's the sublingual gland. Here's the thyroid cartilage. Here's the cricoid cartilage. Here are the superior constrictor, the middle constrictor, and the inferior constrictor. Here's styloglossus and stylopharyngeus. Here's palatoglossus and palatopharyngeus. That brings us to the end of this long section on the oral cavity and the structures that surround it. In the next section, we'll look at the larynx and its surrounding structures. The larynx controls the passage of air into and out of the trachea. The muscles of the larynx can both open and close the airway. In addition, the muscles of the larynx adjust the length and tension of the vocal folds, leading to the production of voice sounds. We'll start by seeing where the larynx is and what it looks like from behind and from above. Next, we'll look at the cartilages of the larynx and the vocal ligaments. Then we'll look at the muscles and the movements they produce. At the end of this section, we'll also see the infrahyoid muscles that are in front of the larynx and the thyroid gland that's just below it. We'll start by looking at the front of the neck, with just the skin and subcutaneous tissue removed. We'll remove the sternocleidomastoid muscles and the clavicles. And we'll also remove these slender muscles, the infrahyoid muscles. We'll see them later. This is the thyroid gland. We'll see it later too. For now, we'll remove it. Here's the thyroid cartilage. Here below it is the cricoid cartilage, hidden by the cricothyroid muscle. These two cartilages form the framework of the larynx. The thyroid cartilage is suspended from the hyoid bone, which is here, by the thyrohyoid membrane. Below, the cricoid cartilage is continuous with the upper end of the trachea. Here on each side, this sleeve of connective tissue, the carotid sheath, contains the major blood vessels of the head and neck. We'll remove the carotid sheaths. We'll also remove the musculoskeletal structures behind and below the larynx. Here's the trachea, here's the esophagus, here's the lower part of the pharynx. To see the larynx from behind, we'll remove the posterior wall of the pharynx. Here's the opening of the larynx, the superior laryngeal aperture. It faces almost directly backwards. The opening is formed in front by the epiglottic cartilage, on each side by this fold of soft tissue, the aryepiglottic fold, and behind by two important structures that we'll meet in a minute, the arytenoid cartilages. The space that's lateral to the aryepiglottic fold is the piriform recess. Here in front of the epiglottis is the back of the tongue. The space between the tongue and the epiglottis is the vallecula. To see the larynx from inside, we'll look at a specimen that's been divided in the midline. Here's the epiglottis, here's the aryepiglottic fold, here's the divided thyroid cartilage, and the divided arch and lamina of the cricoid cartilage. The important features of the wall of the larynx are this small side cavity, the vestibule, and these two folds in the mucous membrane, the vestibular fold above and the vocal fold below. Just beneath the mucosa of the vocal fold is an important structure, the vocal ligament, which we'll see shortly. Here's the larynx in the living body, seen from above with an endoscopic camera. Here's the epiglottis, here's the left aryepiglottic fold, here are the vestibular folds, here are the vocal folds. Here between them, we're looking down through the vocal opening into the trachea. To get a preview of the muscles of the larynx, we'll remove the mucous membrane from here down to here. Some of the muscles of the larynx are visible here, others are hidden by the thyroid cartilage. We'll see these muscles later in this section. Before we look at the muscles, we need to take a further look at the cartilages of the larynx. Then we need to understand the vocal ligaments and the vocal opening. In looking at the cartilages, we'll first revisit the thyroid and cricoid cartilages, which we saw in the last section. Then we'll add to our picture the epiglottic cartilage and the small but important arytenoid cartilages. We took a good look at the thyroid cartilage and the cricoid cartilage in the last section. As we saw, the two cartilages articulate here. When the arch of the cricoid moves up and down, the top of the lamina moves backward and forward. The two cartilages are held together at the front by the strong cricothyroid membrane, which is part of a larger structure, as we'll see later. Now we'll add the epiglottic cartilage to the picture. The epiglottic cartilage is shaped like a leaf, with a slender stem that's attached here to the thyroid cartilage. The epiglottic cartilage is also attached to the body of the hyoid bone by fibrous tissue that runs through this pad of fat. The epiglottic cartilage is covered by mucous membrane here on the back and on the front down to here. The epiglottic cartilage is highly flexible. Next we'll add the arytenoid cartilages to the picture. Here they are. The arytenoid cartilages, which are highly mobile, sit on top of the lamina of the cricoid cartilage, just to each side of the midline. They articulate with the cricoid cartilage at these two surfaces. Here's the right arytenoid cartilage, seen from behind. This tall upward projection is the colliculus. This pointed forward projection is the vocal process. The vocal ligament is attached here. On the underside, this inward-facing articular surface articulates with the cricoid cartilage. Next to the articular surface, this projection on the lateral aspect is the muscular process. Muscles are attached to the muscular process, and also to the lateral border, and to this broad convex surface, which faces forwards. The top of the colliculus is prolonged by this tiny corniculate cartilage, which faces backwards. In the intact larynx, the arytenoid cartilages are here. When seen from the side, the arytenoid cartilage is here, with the vocal process just in line with the vocal fold. The arytenoid cartilages can move laterally and medially, and they can rotate about a vertical axis. When the muscular process moves backward and forward, the vocal process is abducted and adducted. Now that we've looked at the skeleton of the larynx, it's time to get acquainted with the vocal ligament and the vocal opening. To see the vocal ligament, we'll look at a specimen in which the lamina of the thyroid cartilage has been removed on the right side. Here are the vocal processes of the arytenoid cartilages. We'll add the vocal ligaments to the picture. Here they are. The vocal ligaments run from the thyroid cartilage in the midline to the tips of the vocal processes of the arytenoid cartilages. They're fixed in front and highly mobile behind. Their tension is affected by the tilt of the cricoid cartilage. The gap between the vocal ligaments is affected by rotation of the arytenoid cartilage. The vocal ligament isn't an isolated structure. It's the free upper border of this cone-shaped sheet of membrane, the conus elasticus. The conus elasticus is attached below all the way along the upper border of the cricoid cartilage. Its upper border, which is free from here to here, forming the vocal ligament, is attached further back to the arytenoid cartilage. The anterior part of the conus elasticus is firmly attached to the thyroid cartilage, forming the cricothyroid ligament, which we saw earlier. Here's the right half of the larynx, with the mucous membrane intact. The conus elasticus is just beneath the mucous membrane, here. The mucous membrane is closely attached to the vocal ligament and also to the inner aspect of the arytenoid cartilage. At the level of the vocal folds, there's a narrowing between the walls of the larynx. Its anatomic name is the rima glottis, but in this tape we'll refer to it as the vocal opening. Its shape is extremely variable, depending on the movements of the arytenoid cartilages. Here's the vocal opening in a living person, seen from above. In quiet breathing, the opening is diamond-shaped. When we breathe deeply, it widens to a triangle. When we speak or sing, it narrows to a slit. When we hold our breath, it closes completely. Now we'll look at the muscles that produce movement between the cartilages of the larynx. First we'll see the cricothyroid muscle, then the two cricoarytenoid muscles, then the thyroarytenoid, transverse arytenoid, and aryepiglottic muscles. Here are the thyroid and cricoid cartilages with all the muscles removed. We'll add the cricothyroid muscle to the picture. Here it is. The cricothyroid muscle arises from here on the cricoid cartilage. It inserts on the thyroid cartilage, partly here on the lower border, and partly here on the inner aspect of the lamina. the cricothyroid muscle pulls the arch of the cricoid cartilage upwards. In doing so, it pulls the arytenoid cartilages backwards, making the vocal folds longer and tighter. To see the remaining muscles, we'll remove this half of the thyroid cartilage together with the cricothyroid muscle. Here are the internal laryngeal muscles. To begin understanding them, we'll take them all out of the picture for a moment. Here's the cricoid cartilage. Here's the arytenoid cartilage. Here's the conus elasticus. The vocal ligament is up here. This is the mucosa of the vestibule. The first muscles to add are the two cricoarytenoid muscles. Here's the posterior one. Here's the lateral one. They both converge on the muscular process of the arytenoid cartilage. The posterior cricoarytenoid muscle arises from here on the back of the lamina of the cricoid cartilage. The lateral cricoarytenoid muscle arises from the upper border of the cricoid cartilage. The posterior cricoarytenoid pulls the muscular process backwards. This rotates the arytenoid cartilage, thus widening the vocal opening. The lateral cricoarytenoid pulls the arytenoid cartilage forwards and laterally, producing a maximal widening of the back of the vocal opening. The cricoarytenoid muscles act to widen the vocal aperture in two different ways. The next two muscles that we'll see, the thyroarytenoid and transverse arytenoid muscles, act to shorten and narrow the vocal opening. We'll add the thyroarytenoid muscle to the picture first. Here it is. The thyroarytenoid muscle arises from here on the inner aspect of the thyroid cartilage. It inserts here in front of the lateral border of the arytenoid cartilage. Next we'll add the transverse arytenoid muscle. Here it is. The transverse arytenoid muscle, also called the arytenoideus, is a sheet of muscle that bridges the gap between the posterior surfaces of the two arytenoid cartilages. Let's see how these two muscles work. Contraction of the thyroarytenoid muscle rotates the arytenoid cartilage inward and pulls it forward, along with the cricoid cartilage. This action slackens the vocal ligaments and shortens the vocal opening from front to back. Contraction of the transverse arytenoid muscle brings the two arytenoid cartilages closer together, thus closing the posterior part of the vocal opening. The sphincter action of the last two muscles is augmented by a pair of slender muscles that pass upwards toward the epiglottis, the aryepiglottic muscles. These begin behind the transverse arytenoid muscle, cross the midline, and extend upward and forward a little below the aryepiglottic fold. Acting together, the thyroarytenoid, transverse arytenoid, and aryepiglottic muscles act as a sphincter that can completely close the larynx. We close our larynx every time we swallow, cough, and hold our breath. The most medial part of the thyroarytenoid muscle, which is attached to the vocal ligament, has a special function. It's known as the vocalis muscle. It makes fine adjustments to the tension of the vocal ligament. We'll end this section on the larynx by looking at the structures that